Good day everyone. We are now going to see about hyperopia. Hyperopia, also termed as hypermetropia or farsightedness, is a common refractive error in children and adults. Hyperopia can result from a relatively flat corneal curvature alone or in combination with insufficient crystalline lens power, increased lens thickness and short axial length. Ultimately, the light entering the eye is not focused on the retina but somewhere behind it when the accommodation is at rest. The result is that they can clearly see objects from far, but the images of the object nearby are blurred. In young people, this problem goes unnoticed as the nearby objects can be focused clearly by the increased use of accommodation. But as people age, the accommodative power gets diminished or lost, forcing them to seek treatment. When the distance between the cornea and retina is too short, the point of focus technically falls at a point behind the retina. Therefore, the light rays after being converged by the lens cannot be focused on the retina. The circular muscle inside the eye, called the ciliary muscle, which is attached around the lens, does the job of automatically adjusting the focus. When this muscle contracts, the lens thickens and increases the curvature and hence adjusts the focus. Many children who are born with this defect may not notice it until it becomes severe. Some of them outgrow hyperopia in the sense that the eyeball grows to a normal size, thereby eliminating the problem. Clinically, hyperopia may be divided into three categories: simple, pathological and functional hyperopia. Simple hyperopia is due to the normal biological variation like short axial length, flat curvature of cornea or reduced refractive index. Pathological hyperopia is caused by the abnormal ocular anatomy due to maldevelopment, ocular disease or trauma. Functional hyperopia results from the paralysis of accommodation. It will be noted that the contraction of the ciliary muscle in the act of accommodation increases the refractive power of the lens so that it can correct a certain amount of hypermetropia. Normally, there is an appreciable amount corrected by the physiological tone of ciliary muscle, and consequently, the full degree of hypermetropia is revealed only when this muscle is paralyzed by the use of drugs like atropine. Total hypermetropia may therefore be divided into latent and manifest hypermetropia. Latent hypermetropia is overcome physiologically by the tone of ciliary muscle. Manifest hypermetropia can be further classified as facultative and absolute. Facultative hypermetropia is overcome by an effort of accommodation. Absolute hypermetropia is the amount of hypermetropia which his efforts of accommodation cannot correct. Let us suppose the hypermetrope cannot see a distant object clearly. We then place convex lenses of gradually increasing strength until he can just see clearly. At this moment, the lens and his accommodation are both acting so that with the combination of them, a distinct image can be seen. The amount of hypermetropia corrected by the lens, that is, the amount of which his efforts of accommodation cannot correct, is the absolute hypermetropia. It is measured by the weakest convex lens with which maximum visual acuity can be obtained. We now add stronger lenses until we reach the strongest with which the clear vision is still maintained. During this process, we have been substituting the converging power of the effort of his accommodation by the lenses. This measure of hypermetropia, which he can correct by his own efforts, is called facultative hypermetropia. It is determined by the difference between the strongest and the weakest convex lens with which maximum visual acuity is obtained. So, what are the symptoms experienced by a hypermetrope? To begin with, difficulty in focusing on nearby objects should be the sign of long-sightedness. While distant vision may be sharp and clear, nearby vision will be blurred, compelling the individual to wipe his eyes until it clears away the blur. Unlike in myopia, the blurred image will not improve even when one reduces the eye to a slit. Typically, children would stand close to the television screen to have a better look and would complain if asked to move away from the screen. At birth, nearly everyone is somewhat short-sighted, but the extent of error diminishes as the eye grows. A mild error may not be noticeable, for the accommodative power of the eye compensates for the error, but if it does not get better, other complaints arise. The extra strain on the eye to focus properly turns the eye inside towards the nose, making one squint or cross-eyed. In children, it affects their concentration, probably because they are unable to read well. As the hyperopes have difficulty in focusing on objects close by, subconsciously they step away from reading and studying, which is projected as lack of attention span frequently. If left unattended, it could even lead to a poor academic performance. Apart from blurred vision, headache is a common symptom. As the brain strives to concentrate harder, the excess strain causes asthenopia, a clinical term which is used to describe eye strain accompanying the comforts like the pain around the eye and headache. The brain continues to process the blurred images that do not make sense. Hence, as a reflex, the person tries to furrow the brows to concentrate harder. Accommodative dysfunction, which means that the eye is not able to automatically adjust to closer vision, is another symptom that develops in individuals with hyperopia. As a subconscious manifestation of continuous strain for vision, irritability could develop. Prolonged eye strain can cause redness in the eye. As presbyopia develops due to age, hyperopia remains hidden or ignored. As people become older, the error of hyperopia can increase because of the increase in the refractive index of the crystalline lens. Amblyopia, which literally means lazy eye, is more commonly seen in hyperopic children as the brain shuts off the visual processing of the blurred image. Diagnosis of hyperopia is usually done by a comprehensive examination of the eye after dilatation. General ophthalmic examination include measurement of intraocular pressure, visual acuity for distance and near, refraction, color vision, extraocular movements, slit lamp examination and fundus evaluation. The far-sighted persons have struggle in reading the chart for near vision, but find it easy to read the chart for distance. There is no universal approach to the treatment of hyperopia. Each patient should be considered in terms of age, degree of symptoms, amount of hyperopia, state of accommodation, visual acuity, and the efficiency during the performance of visual tasks. Young children may not need any corrective glasses. The eye may grow with age and reduce the incidence of hyperopia. The goals of treatment are to reduce accommodative demand and to provide clear, comfortable vision and normal binocularity. Eyeglasses, contact lenses, and refractive surgery are the means to deal with hyperopia. All levels of hyperopia can be corrected by wearing proper prescription glasses. Prescription glasses help refract or bend light rays before they enter the eye. The eye specialist will evaluate the error caused by hyperopia and prescribe glass accordingly. These glasses will correct error and compensate for the loss of focusing ability. The primary modality of correction is through spectacles or glasses. Spherical lenses are employed to correct the error. The lens faces the light rays before it enters the eye. This shortens the focal length such that the image which was falling behind the retina now falls on it, resulting in clear image. Very often, people are known to resist the change and do not tolerate the full correction brought on by the corrective lenses. In young children below the age of 7 years, some degree of hypermetropia is physiological and a correction may be needed only if the error is high or squint is present. In older children, it is safest to give fullest spectacle correction that is consistent with good vision. Hyperopia equal to or greater than 1 to 1.5 diopter sphere generally require full-time distance correction with a near addition for patients over about age of 45 years. The various surgical options are hyperopic LASIK, phakic IOLs, non-contact holmium YAG laser, thermokeratoplasty. Hyperopic LASIK is used to correct mild to moderate hypermetropia, which refers to the hypermetropia from the range of +1 diopter to +4 diopter sphere, and the phakic IOLs for higher degrees of hypermetropia, which refers to hypermetropia of +4 to +10 diopter sphere. Phakic IOLs for hypermetropia are specially designed foldable, convex, thin lenses implanted in the posterior chamber behind the iris and in front of the normal crystalline lens. Non-contact holmium YAG laser or conductive thermokeratoplasty is suitable for lower hyperopia in the range of +1 diopter to +2.5 diopter sphere, where multiple radially distributed spots in the paracentral cornea lead to shrinkage of the collagen in the mid-peripheral stroma and thereby consequent steepening of the central cornea. Older patients with hyperopia who want greater spectacle independence are suitable candidates for refractive lens exchange.
hold me where you stood since the day I dreamed you. Smiled and said you knew I could. It's time to show the world just what we've had in mind. I don't have the slightest doubt that we will pass the test of time. Not so long ago when the clouds hung low, the sunshine never made it through. But every day's been beautiful since the day that I met you. Forever since that day. We shared a life, we shared a lock and key. Since the day we understood, you touched my hand and said, you love me. Since the day we both cried, since the day that stands out as the best, since the day I bought that ring, since the day you said yes. It's time to show the world just what we've had in mind. I don't have the slightest doubt that we will pass the test of time. Not so long ago when the clouds hung low, the sunshine never made it through. But every day's been beautiful since the day that I met you. Forever since that day. A day when I can't find a reason or rhyme, I think about the places I have yet to roam with you walking by my side. When life's winding road turns dark and cold, I know we'll see it through. I sit back and smile at the thought of growing old with you. Forever since that day. Since that day, forever since that day.
Hence, to conclude, farsightedness is a refractive condition where the focusing power being too weak for that eye, resulting in a visual image being focused behind the retina rather than directly on it. Farsightedness is often present from birth, but children have very flexible eye lens which helps to make up for the problem. As aging occurs, glasses or contact lenses may be required to correct the vision. Acuity is affected according to the amount of hyperopia as well as the patient's age, visual demands and accommodative ability. In severe cases of hyperopia from birth, the brain has difficulty in merging the images which each individual eye sees. This is because of the fact that the images which the brain perceives from the eyes are always blurred. A child with severe hyperopia has never seen clear objects at all. Hyperopia can be corrected by prescription glasses, contact lenses and refractive surgery. Glasses are the simplest and least expensive and will solve the problem in most of the cases. Contact lenses provide better relief from the problem because of their proximity to the eye. Surgery is the viable option in some mild cases but may be inevitable in extreme cases where the problem is complicated by the presence of other refractive errors like presbyopia and astigmatism. Thank you.